Hey everybody, my name's Chris. I work in engagement with I work in patient and family engagement with ImproveCareNow. I apologize. I was trying to read the chat and say hi. Welcome to the virtual community conference. We're excited that everybody is here on World IBD Day. It's the first time we've held this event on World IBD Day, and so we're excited to bring everybody together. A couple of reminders before we get started with the presentations. One, if you're on your phone, please don't use the hold feature. We're going to ask that you put your name in the chat box in just a second, and just be aware that more than one person can view the chat box at a time. And we're recording this session. We're going to share afterwards for folks who couldn't make it. And if you see any charts, any data that's shared here, please don't take screenshots or share it. It's meant for the folks who are on this call. And folks who watch the recording. And so we want to start out. Can you put your name in the chat, and then if you're associated with a center that's in the ImproveCareNow network, what center you're from? If you're not, that's great. Welcome to. If you could put what part of the country you're from in the chat, and I'll try to get it started. My name is Chris, and I'm from Columbus. And feel free to go ahead and continue to do that. I'm going to keep moving the slides forward. But this is just a good way to get to know each other at the beginning. We're going to have some breakouts later on. Our hope is that this session has parts that are very, very interactive. And we're trying breakouts for the first time in one of these, and so we're excited for everybody to be here and get to know each other a little better. A little bit about virtual conferences. We think it's a great way to build community between patients, families, and clinicians. An opportunity to celebrate our successes. A great way to find ways to get involved, and we hope that it's full of something for everybody. And what do we want to accomplish tonight? One, your knowledge and awareness of ImproveCareNow is going to increase. Two, you'll be able to better describe opportunities to get involved, ways that you can make a difference, and here's something you may want to get involved with, or something that you may find useful that you can take back and implement, and that helps improve your life. Our agenda for tonight, we're going to start out with a state of the network by our executive director and clinical director. We're going to hear from our National Patient Advisory Council and Parent Working Group. And then the main session tonight is going to be on the importance of advocacy for patients, families, and the community. And we're really excited about that. We're going to do the breakouts there. I think it's going to be a great session. Before we start, I do want to say, as tonight is World IBD Day, there are more events going on than just this one with ImproveCareNow. The Stanford Children's IBD Center is hosting an event tonight. It starts at 9 Eastern or 6 Pacific. Called IBD Success Stories. That is a QR code, and if you scan that with your phone, it'll take you to the RSVP that has the information about that event. There should be half an hour, 45 minutes between this and when that kicks off, and so enough time to maybe grab something to eat, and then jump on. I'll have this slide later, right before we leave, but you can scan that, and it'll take you right to the RSVP. The other thing I want to say is we may not have time for questions in every presentation. Please feel free to put them in the chat, and we'll either answer them there. If the presenter doesn't have an opportunity to answer them, we will save that chat and try to get that answered from you or for you later on. With that, I'm going to stop sharing my screen, and I want to turn it over to Kristen and Shazad to kick us off.
Alrighty. Hey, everybody, give me just one moment to pull up my screen. Can you all see my screen?
Yeah, we got you.
And it's the right screen, right?
It is. It is. It's just a beautiful, stronger together tree.
I love it. We're going to talk more about that. It's a good teaser. Okay, so I just want to start by just saying thank you to all of you for taking the time to be with us tonight. We're really happy to have you. As Chris mentioned, I'm Kristen Howe. I'm the Executive Director of ImproveCareNow, and I have the pleasure of being here tonight with my colleague and friend, our Clinical Director, Dr. Shahzad Saeed. So Shahzad and I wanted to share just a few themes from our last online network community conference and give you a sense of where we are right now as a network community, where we're looking to go, and most importantly, how you can be involved. Before I dive in, I just wanted to kick us off by reinforcing our shared purpose, which you see in front of you on the screen, and our community values. Please keep these values in the back of your mind and remember them as you engage with this community tonight. So for the rest of the evening, I do want to ask you to keep 3 R's in mind. This was the theme that we shared just a few months ago, with the network in the network-wide online community conference. And I think it really resonates, and we wanted to share it with you tonight. So the 3 R's that I want you to keep in the back of your head are reflection, resilience, and recovery. So we're going to start with reflection. Consider the strong foundation of ImproveCareNow, the roots of our community and how that really enables our work, both as individual contributors to the network and as a part of any number of the larger teams that we play a part of. The next is resilience. And we're thinking about how we've come together as a community over the past 1.5 years to overcome any number of challenges and really advance the work of our network. Like the hands on this tree, our community members have offered support, structure, and strength during these really challenging times and enabled our network to continue to make progress despite adversity. And finally, recovery. What about the new growth that lies before us as we look at the coming year and beyond? So together, these 3 R's of reflection, resilience, and recovery make up this amazing logo that so beautifully represents our community. So starting with the theme of reflection, I wanted to take just a few moments to share some of my own personal thoughts and reflections over the last 18 months. More than 1 year ago, when we were first introduced to all things COVID and we entered into our own version of lockdown, whatever that was, unsure of what that meant or how long it would last, one of the early learnings that I think many of us had was sort of this forced time to slow down and pay closer attention to the world around us. And as I reflect on where we are now, I remind myself often of that same lesson. You know, I find myself racing around my house, trying to fit in all of my daily work, to be a mom, to be a wife. And I'm sure this resonates with many of you. And I continue to remind myself of this learning of being present. And I heard it over and over again from those around me at the beginning of the COVID pandemic, that despite the struggle, despite the challenge, there was this sort of sense of peace and of joy and the ability and the time to slow down and to really be present and leave that culture of busy behind. And I think that's really beautiful to find those moments of peace in an otherwise really crazy time. So I just wanted to invite all of you now to just take a moment, put your phones down, stop multitasking. If it feels right to you, close your eyes, take a deep breath, and just be present in this moment, prepared to spend the next couple of hours in this space with this community. You know, as a network, we are less than 1 year out from a major leadership transition. We're in the midst of a significant technology overhaul, and it's important that we keep this in mind as we interact with our families, our communities, and our colleagues. Be present in what we're doing. The second reflection I wanted to share is that connections matter. Connect with each other, your family, your coworkers, your neighbors, your loved ones, even when it doesn't seem like there's enough time in the day to do this. Connections are at the core of what we do in ICN, and it's something that our community really excels at. And I'm so grateful to work with people every day who embody this sense of connection. Humans need to be seen. I think I had the pleasure of coming and speaking to a similar group at our last virtual community conference about 6 months or so. And at that time, I think I talked about this innate need that we all have really from birth or from childhood as people to be seen for who we are and for what we are, to really be recognized. And I think that this last year has reinforced that importance of recognizing the need and the value for human dignity. So I ask you all to take this time to really see and hear each other as you engage with this community tonight. Smile, even when you're grumpy, even when things are hard, even when the person on the other side of the counter from you or on the other end of the Zoom line is not being kind. You never know what people are struggling with, and your smile, your small dose of kindness might be just what they need. And if it's not, that's okay. You are no worse off for having shown some kindness to them. At our last network-wide community conference, I shared with the group a story about my 7-year-old daughter and something that she had said at the dinner table. She said, Mama, when you're kind to people, you don't just fill their bucket, you fill your own too. And I hope that this time together tonight fills your bucket even a little and makes you feel proud of what we have done and what we continue to do. And I hope that it makes you smile. Before we go too much further, I want to take a quick moment to thank this incredible ICN team, many of whom are here tonight, and they work behind the scenes every single day to make this network run, and they make me smile and they fill my bucket. So thank you guys. And my final reflection is that toilet paper matters, and especially in the IBD community, it really matters. And so with that, I will turn it over to my friend, Dr. Shahzad Saeed.
Thank you, Kristen. Thank you, Chris. Thank you, everyone, for joining us on an evening on the East Coast here in the US. I know we have people joining from all over the country and hopefully from around the world. It's a great way to celebrate, acknowledge World IBD Day. And as you will see later on, as Chris shared, this is a great sort of alignment with the theme of advocacy that we want to sort of acknowledge and advocate on behalf of a condition, a disease, which is not dinner table discussion or talk. So make yourself heard, make yourself known, and put a picture to the story. Thanks, Kristen. I will sort of carry on the theme from the last virtual community conference with the second R, which is resilience. And resilience is defined as the capacity to recover quickly from difficulties, toughness, the ability of a substance or object to spring back into shape, or elasticity. The American Psychological Association defines resilience as the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. And boy, haven't we seen that in the last 1 year in different shapes and forms. And a number of us, our families, are battling this as we recover and tackle the pandemic. But as much as resilience involves bouncing back from these difficult experiences, it can also involve profound personal and professional growth opportunities. And ICN embodies that, not only in spirit, but also in concrete and measurable ways, as noted in some of the upcoming slides. Kristen, next, please.
Sorry, my screen is frozen. Give me a moment. There we go. Did that work?
Yes, it did work. Right. So just celebrating the fact that we have all 10 honor roll Children's Hospital from the US News and World Report Children's Hospital ranking. And we have 41 out of the top 50 pediatric gastroenterology programs represented in the network. And again, that's a recognition of all the great work that you at centers and as stakeholders do to be recognized. Next, please. Next slide sort of talks about the remission rates. We see this run chart of remission rates here. And as compared to 2013, a moment of reflection as well here, When we had our remission rate as 77%, our current remission rate is 82%, which means that 11,000 additional children are in remission now as compared to 7 years ago. And we have 58% of ICN centers that have met or exceeded this goal. And these dots on a run chart are not just dots alone. They actually represent patients. They represent Jenny, Sammy Kennedy, Alex Joffrey, Christian, Becky, and Bianca. So we need to keep that in mind as we look at this data and these numbers, that they're actual people, people that matter, people that have opportunities for improvement in their outcomes, in their quality of life, in their future. Next, please. Similarly, as compared to 7 years ago, we have achieved a sustained clinical remission rate of 58% now as versus 48%, so a full 10% improvement, which translates into 7,000 more children in sustained remission as compared to 7 years ago. And 40% of our ICN centers have met or exceeded this goal. And again, these data are actual people. And since launching of our Pathway to Mastery process 2 years ago, this has resulted in improved network-wide clinical remission rates from 81 to 82%, which again means almost 2,000 more children in remission, and has resulted in improved sustained clinical remission from 54 to 56%, again, almost meaning 1,700 more children in sustained remission 2 years into this journey of ours. As compared to 7 years ago, we have, when we had 50 centers in the network, now in 2021, we have 109 centers. Again, this reflects the resilience, the growth, and the broad impact of our community and of our messaging. Next, please. I'm just going to share just briefly, and again, we can have conversation later on where we sort of want to focus on the strategic plan for the network. We have 5 buckets that we are working on from a strategic plan perspective over the next 3 years. These buckets are broadly outcomes, diversity, equity, and inclusion, financial resilience and sustainability, engagement, which Chris will talk about, and technology. And a number of people from different centers are very much aware of the transition to our upgraded registry, Hive outcomes, and that's again an exciting opportunity for us. Our focus always remains to improve outcomes while closing the equity gap. And we have our newly launched Diversity, Equity, and Inclusion Committee led by Sandy Kim and Lisa Pitch. And a call out for membership was made last week. So please, if you're interested, join us. And we will continue to focus laser-like on our financial sustainability and engagement. Next, please. We have heard and we share that we are just doing my job. What if you are just not doing your job, but actually improving your job? And that becomes the mantra for a quality improvement collaborative like ours. We are actually improving our job. Next slide, please. Yet, what I've observed over the last 1 year is a feeling in the network of determination. Determination is not only what we can do, but how we do it. The word yet captures the concept of the continuous improvement spirit. You can add it to any sentence related to a journey of contribution and achievement. Yet, next slide, please. Yet is what we earn with learning, insight, and generosity. Yet is about what we anticipate in the future. Yet we haven't achieved more than 70% of patients in sustained remission. We haven't opened communication with 10,000 patients and families or routinely made them aware of the resources that you all have created within the network. We have become aware of the equity gaps, but we haven't closed them. So yet is about what we anticipate in the future. And the future for ICN, for you as a community, is bright and full of promises of better things to come. Better treatments, better resources, better partnerships, better outcomes, and better quality of life. And with that,
So as we think about what is yet to come for this network community, I wanted to turn now to really the most important part, and the sort of this idea of recovery and how you can be a part of the ICN community and how you can get more involved. And I think you'll hear a little bit more about this evening. So I want to start with just saying that every one of you can make a difference to each other, to our kiddos, to this network, to your site in any number of ways. And you can start by just making those around you aware that this community exists. Share your story, share your lived experience with them, and invite them to be a part of the community as well. We invite you to surface and participate in the solving of problems that you encounter across the network or at your own individual sites. You know, often each of us only see this very tip, this very top part of the icebergs that we encounter in our day-to-day experiences. And together we can really uncover what lies underneath, and we can collaborate to address those issues and solve them. We invite you to ask questions of each other, of yourselves, and share ideas. And finally, we invite you and encourage you to pursue an innovation or participate in research. This is a wonderful way for you and or your family to be involved in the network and really help us to improve outcomes for all of the kiddos that we're working with. So in closing, if you are looking for perfect, you're in the wrong place. That is not ICN. If you're looking for forward movement and for determination and a relentless focus on making a continuous improvement in the lives of our kiddos, then you found your people. I am filled with gratitude for everyone in this community. I am filled with gratitude to be a part of this community. Thank you for being a part of our ICN journey and for allowing us to be a part of your journey as well. So Chris, with that, I will stop sharing and I will turn it back to you.
Thank you. Thank you so much. Before I pass it over to our next presenter, I just wanted to acknowledge in the chat, there's been some conversation about closed captioning. It's something that we're working on to see if it's available on our account. It may be part of a paid third-party service that we don't have right now, but we're working on it. I wanted to acknowledge it so that y'all know it's something that kind of in the background we're working to see if we can get turned on. If we can't for this, we'll work to make sure to see if maybe the videos can be auto captioned. I know YouTube has some auto captioning. I just wanted to acknowledge it and say it's something that we're working on seeing if we can do. And if we can't, we'll look to see if there are other solutions. I'm gonna turn it over to the folks from the Patient Advisory Council. Becky and Maddie.
Hi. Yeah, I think Maddie might be having some tech trouble, so I'll go ahead and get started. Yeah, I'm Becky, and Maddie is also going to be on the call too. We are the co-chairs of the Patient Advisory Council. So for anyone who doesn't know, basically the PAC is part of ICN, and we're a group of patients with inflammatory bowel disease, ages 14 and up. And our job is advocating for our patient experiences in ICN. Next slide, please. So first of all, what really is the Patient Advisory Council? So we're, again, like I said, patients 14 and up. We have around 70 members right now. And there's multiple kinds of things that the PAC does. We're partially a support group. So there's a lot of support element that comes with being a member of the PAC. There's a lot of group chats, we have conversations, we'll FaceTime. There's a lot of really validating social element there. We also do a lot of advocacy. A huge part of our role in ImproveCareNow is creating patient education resources that we call toolkits. We also talk at conferences like we are now and do other advocacy work. So it's both advocacy and support. The PAC is structured with 3 different pillars. We work on communications, advocacy, and recruitment internally. Communications runs our social media and Loop blog. So this includes Instagram, Facebook, Twitter, Loop, and our podcast, which we'll talk about shortly. Advocacy works on toolkits and engagement. We currently have around 10, I think, toolkits, I'll have to check on that number, spanning a range of topics like ostomies, nutrition, traveling, transitioning, accommodations. I use them all the time. I used one of our toolkits when I was applying to college. I used one of them after I got into college. I used another one right before my most recent surgery. So they're really helpful even to people who help write them. Advocacy also does engagement, so working on finding opportunities for current PAC members and within the ImproveCareNow community and beyond. Our recruitment team works on onboarding new patients. So if you'd like to get a patient involved, you can sign them up on the PAC website or direct them over to our recruitment team. Next slide, please. So we just wanted to take a brief moment to look at our leadership team since a few names have changed. Our co-chairs are currently myself and Maddie. Our advocacy leads are Shira and Rishi. Recruitment is Quint and Maha, and communications is Fiona and Vanessa. Next slide. So one of the really cool resources we've got in production right now that we've been working on for a while, but are really excited to have it come to a sort of close, is the Lifestyle and IBD Toolkit. So we're in the editing stages of this right now. And basically the purpose of this toolkit is to provide an informational and interactive format for patients, providers, and families to use to learn about how IBD impacts lifestyle and how we can manage that. So every patient's journey with IBD is unique, which is why we have so many different sections so that people can really decide which elements of it they'd like to use. And you can see we have 6 main sections here: mental health, socializing, diet, exercise, treatment and surgery, and management. And on the next slide, you'll see that we have a kind of draft website that we're creating. So this is a very early draft stages, but you can see that we're going to have a really cool interactive format where you can just scroll through the website, click on whatever's relevant, and even click on one button and send us an email, which is really cool. And on the next slide, you'll see an example of what one of our pages looks like. So this here is from the diet section about keeping track of trigger foods. So you can see here that we have information from our patient experiences, but a really cool part of this project is that we've done research ourselves as the PAC, and we've also partnered with a lot of providers and staff from ImproveCareNow. So we've got a lot of network involvement on this really big project that we've been working on. So we want to let you all know about that because we are in the editing stages, and hopefully we'll have this coming up in the next few months as an available resource. Next slide, please.
Can you hear me?
Yeah.
Okay, good. So the Health Literacy Toolkit is the second project that the PAC is working on currently. And like Becky mentioned, it's in the early stages, but the goal of the toolkit is to inform patients and parents on various healthcare topics related to IBD. And through this knowledge, have these patients and parents empowered to take charge of the patient's health through their understanding of medical terms, procedures, medications, etc. So if you have thoughts or suggestions for the PAC about what should be included in the resource, you're welcome to reach out to us. We'd love to hear your thoughts. Next slide, please.
So another really cool resource that we're working on that I mentioned earlier is our podcast, which you can find on Spotify. It's called Impact, which is a wonderful pun. And basically what this podcast is a few PAC members getting on a call with each other, and oftentimes including a guest speaker, which can be a PAC alumni, someone in the network, or even people outside of the ICN network. And really, they're just talking about their experiences with a certain topic related to IBD. You can see some of these topics here: resilience, IBD and body image, relationships with food, school with IBD. These are wonderful because they're just around 30 minutes. So I listen to them on the way to doctor's appointments. I've done that. You can find the podcast on Spotify. You can also go onto Google and just type in Patient Advisory Council on Spotify. It should pop up as a link. Yeah, it's really great to listen to. I have found it so validating just to listen to other patients talk about experiences that I have been feeling and thinking. Just to hear those thoughts said aloud by other people is really wonderful, and I've learned so much from listening to those. So that can be another great way to involve any younger patients or older patients who might not be of age or interested in joining the PAC right now. Next slide, please.
So in terms of the future of the PAC, or where we're going as a group, first, we'll continue sharing IBD patient perspectives at the community conferences. We host awesome breakouts at the community conferences, and I highly suggest that if you attend a conference that you listen to us talk, because we have great things to say. Next, we're working to expand patient engagement in the network's projects, including the learning labs, where we'd provide patient perspectives on research or other network-wide initiatives. We're always happy to recruit new members or connect one-on-one with patients under the age of 13, like Becky mentioned. If you have a kiddo who's not quite ready to join the PAC or who's too young to join the PAC, feel free to send them our way. We'd be happy to talk to them. Even if it's just a support call, if they have questions about treatments or procedures, please do send them our way. The PAC is working to convert our current resources into more interactive formats, such as websites or interactive PDFs. An example of that would be the Lifestyle and IBD Toolkit. We want to make these resources as interactive, as accessible, and as cool as possible for pediatric patients to use. We're launching a patient-led diversity, equity, and inclusivity project to highlight patient experiences in those areas. And then lastly, like Becky mentioned, we have a podcast called The Impact, where we discuss patient perspectives and stories. And I highly recommend that you listen to that on Spotify. Next slide.
So briefly, how can you engage patients? Well, first you can sign up for the circle, which we'll talk about briefly in a moment. You can also find our resources online. So that's ImproveCareNow.org/tools, and you can see all of the toolkits that the PAC has made and that ImproveCareNow has made. And you can give these to your kids and patients. And it's a really easy way to engage patients with other patients. You can join the PAC. If you're a patient or a parent with a patient who might be interested, you can encourage them to sign up on the site. If they don't want to, that's okay. But it's a really great community. And like Maddie said, if they aren't interested in signing up, or if they're too young to, but would still like to connect with patients, you can always email us at icmpatients@gmail.com, and we would love to talk to your patient. You can also advocate for your patients to get involved. This can be at a lot of different levels. At your care center, you can get them involved nationally. You can send them to camp. You can have them involved at QI meetings. You can even get them involved just with their own care. But that's a really important part, advocating for patients to get involved. Next slide.
So what does the PAC offer you, our audience? First, for patients, we offer social support. So like Becky mentioned earlier, the PAC is really a tremendously significant support resource. We talk about our experiences, we share stories, we share tips and tricks that we've learned along the way. And when it comes down to it, we're all just best friends, and it's a wonderful place to be. Next, our patient resources. We have patient-led toolkits and the podcast. that help patients feel less alone in their illness, which is a really important part of living with chronic illness. Next, we mentor new or younger patients who are not quite ready to join the pack or too young. Again, if they have questions about treatments, if they're going into a procedure, their first colonoscopy, and they have questions and they want to hear it from a patient perspective, we're happy to do that. We support ICN research projects. We provide patient perspectives on different initiatives. And then lastly, we provide patient perspectives on the center and national level. So if that means that we're at a center level ICN meeting, creating projects for our fellow patients at our care center, or if it's participating in national level initiatives with the Patient Advisory Council, both of those are incredible ways that we provide patient perspectives. Next slide.
Before we close with our circle push, another way that you can engage with your patients is our TikTok account. Yes, that's right. We are going to be creating a TikTok account. So this will be educational and comedy related. So once we have more information on that, we will share it with the Improve Care Now community. And since that's a really popular form of social media, that's a great way to get your kids and patients involved with the pack, even if they might not be old enough or interested in joining. So our circle ask is to basically just present the idea that all of our pack toolkits are shared by the circle. So there is thousands of patients, parents, and friends and family members that we all have who've not yet joined the circle and could learn from these resources. So our ask for you is to share about the circle and how staying connected with Improve Care Now has impacted you and your family's journey with IBD. And you can encourage the people you know who might benefit from this to sign up. And you can reach out to someone directly and share your story, but really just encourage them to get involved if you think they might benefit. Thank you and happy World IBD Day.
Thank you all. Thank you all so much. I think next up we have the ICN's parent working group. Jill, you good? Ready?
I am good to go. Can you hear me okay?
We can. I should say, you may want to push your camera down a little bit, or like we got your, there you go. I'm sorry. Okay. We like had your glasses, but not that.
Trust me, I'm doing you a favor.
Jill, take it away.
So welcome everybody. So honored to be here tonight. I'm so happy that you could join us tonight on World IBD Day. Chris, could we advance the slide, please? So the biggest thing is welcome. You made a tremendously smart decision by joining us here this evening. And one thing I want you to what resonates most about the parent working group is you are not alone. And so if you take anything from today, I hope that you realize that there is a community of support here within the ICN community, which is global, and that you are not in this journey alone. Next slide, please. So when we think about the parent working group, my friend Shelley, who's part of our strategic committee, our strategy committee, she was quoted in saying these 3 words come to mind when she thinks about Improve Care Now: collaboration, connections, and community. And so I loved the picture of the ant bridge as a metaphor for really what we're doing here in ICN, that together we can accomplish so much, and that we're building bridges, not just for our own kids, but for all the kids who are diagnosed in the future. And that with those connections, we're unstoppable. And that although it may feel sometimes that the road is uphill and that we can't get there, look at the power of what can happen when we join together and we join those forces together. And so I want you to think about collaboration, connections, and community when you think of the parent working group and you think of ICN and what it can bring to your life. Next slide, please. So what is the parent working group? The parent working group is made up of it's a volunteer organization made up of dedicated parents and caregivers working together with other stakeholder groups to improve care for children and adolescents with inflammatory bowel disease. And the picture is from one of our community conferences. In fact, you will be joining a group that's dynamic, smart, and truly motivated to improve care across the network. Next slide, please. So right now, we are in a phase of transition. And because we are a quality improvement organization, we always strive to the ideal state. And as Kristen mentioned in her group, if you're looking for perfect, we're not there yet. And that's okay. I think what the resonating goal that I want you to, the big message that I want you to remember is that we are a group that's working forward, that we're learning what we don't know, so that it can propel us in the future and really help us reach our goals. So our overarching goal is that we want to make sure care is improved for all kids, regardless of where they receive care. One of our long-term goals is to develop the parent working group infrastructure and outreach to help local centers develop a system in which all stakeholders are at the table. One of our more immediate goals is to develop foundational documents outlining the mission, vision, and goals and general structure for the parent working group to determine measures of success. Because again, we're a quality improvement organization. One of our other goals is to ensure that the parent voice is heard throughout the ICN network. And by parent, I mean all caregivers. And another goal, another overarching goal is to develop ongoing educational opportunities for parents to learn more about ICN, about quality improvement, and to make collaboration easier through trainings, ICN 101, engagement, and QI work. Next slide, please. So how do we measure success? Well, one of the things that we want to look at are the goals and needs of the parent working group members being met. We need to know what our members need. We need to know how well and widely is the parent voice being shared. How many parents are involved in ICN on the network level initiatives? How many ICN councils and committees and projects include parents? How is the parent working group being shared and spread at the center level? How many centers have parent represented on a parent working group? How many centers have their own parent working group or PFAC or patient advisory council? These are really important pieces that where our focus is. I think it's an incomplete mission if not all stakeholders are at the table. And so that's a really important push for the parent working group. Next slide, please. So I guess the question becomes, what are we searching for in our IBD journey? And so Chris Keck, who's the master of the ladder engagement, kind of put this little thought in my head. I think this sort of illustrates kind of our journey, right? So when you're first diagnosed with IBD, you have a child that you're caring for. There's an awareness that there's probably something out there, but we're not really clear what it is that we're looking for. Then, you sort of go beyond that awareness piece, and then you might sort of dip your toe in and sort of see what this is all about. That would be your participant level. But then it sparks something in you. And then you go to sort of that contributor level, where all of a sudden now you're collaborating with others who have similar goals and missions as you. And then finally, our ownership level, where your passion becomes action. And now that those ideas are collaborating across the network and you're collaborating with all different stakeholders, and that information and that new knowledge is then leveraged. Next slide, please. So what does that translate to in terms of the parent working group? And so these are sort of inverted. So the bottom is the awareness one. And that's probably where a lot of folks, where they sort of land. And they maybe sign up for the parent working group online, or maybe they've signed up for the Circle newsletter or the parent working group Facebook page, sort of dipping your toe in to see what this is all about. Then perhaps you go to the participant level where you sign up for the parent working group all calls, or maybe you download one of the fabulous toolkits of the PAC. But then you feel like maybe there's something else that you can contribute. When you see all that everybody else is contributing, maybe you spark something in you. Maybe it sparks a little flame. And maybe you write your own article for the Loop blog, or you join a parent working group committee. And then finally, you turn that passion into action. and you become a co-chair of one of the parent working group committees, or perhaps you decide to present at a community conference. I can tell you that my involvement in ICN was not the path that I would have chosen. I did not want 2 children with inflammatory bowel disease. I was perfectly content living my life until our kids got diagnosed. And it wasn't until our physician reached out and said, hey, I really am interested in hearing your perspective on how we can improve care. And truthfully, I was a little bit shocked. I thought maybe, it was sent to the wrong parent, because certainly I had no clue what it was that we were doing or how this journey was going. What I can say to you is that this has been one of the most rewarding and personally fulfilling things that I've ever participated in. And so I would encourage you to step outside of your comfort zone. Sometimes it requires you to take that leap of faith and to say, you know what, I have a voice and I have a perspective that perhaps might help somebody else. And so I would like to encourage you to listen to that inner voice. Next slide, please. So what are the parent working group's current activities? Well, overall, we meet on a monthly basis for our all calls, where all members are welcome. There are no bad questions. There's open discussions and sharing. We have a communication subcommittee, which they write a bi-monthly parent working group newsletter that's sent to all members. Currently, we're revamping the newsletter, and we're building and distributing a process based on community feedback. We're kicking off our social media groups with a Twitter presence and Facebook presence. Yes, we're significantly behind the pack, as always, when it comes to being social media savvy. We want to be the pack when we grow up, I think. But the parent working group membership subcommittee, we reach out personally to new members. We're revamping our welcome process because we want to be sure that we're reaching all the folks who are interested in joining us. We do that via email, through personal phone calls, and ongoing recruitment efforts. The parent working group subcommittees, there's research is looking for opportunities to collaborate with the ICN research as a network. Again, making sure that that parent voice is represented. The parent working group strategy committee recruits guest speakers for our monthly calls. They generate ideas and topics and find presenters and basically organize it all. It's pretty fantastic. Maria Tribble, who's on our call tonight, is an absolute dynamo and organizational genius when it comes to that. So we're very grateful to Maria for all her efforts. And then they're also a guiding force for the parent working group advisory committee. So, they work alongside me as the parent working group lead, just to help with the overall direction and strategy of where we want to go. Next slide, please. So what value does the parent working group provide? And so I was asked to write a Loop article a couple years ago. And the thing that really came to mind was there's this sense of support that comes from being around people with similar challenges. And the really incredible part of this is it was support I never realized I needed until I attended that first community conference. And I found my tribe, truly, that there was no need for explanation. There was no need to clarify that my children had inflammatory bowel disease and now irritable bowel syndrome. It was one of the most encompassing, welcoming organizations. You found your people. So as the parent of 2 children with IBD, I found value in the parent working group all calls, the newsletters, and community conferences. They provided me the opportunity to interact with experts on the network, throughout the network, and connect with people who've had shared experiences. And again, it helped me to feel like I'm not alone and that I found my tribe. Next slide, please. So what kind of activities are the parent working group members doing, either within the group or within the network? Well, we have folks who are serving on various parent working group committees. They serve on the local level with their parent family advisory committees or at their local centers. They participate in research, the produce study as an example. Communications, we do the newsletter, we do social media, Twitter, Facebook. And then we serve on various ICN committees and councils. So for example, the research, learning labs, executive board, community council, transition, engagement, diversity, inclusion. And so again, that parent voice is so critical to that piece of it. And again, that lived experience, that perspective is so unique, and that's why it's valuable. Next slide, please. So you have a choice. You can stay on your little rowboat, being content, and like, you know, any small little dinghy, it's going to get you from point A to point B, but you're not going to go that far. You're going to get tired and you're going to get discouraged. Or you can join, you know, I think of those Viking ships, and I think of everybody putting their oars in and everybody's rolling in sync, and that it becomes a mighty vessel. You become a true explorer. You become somebody who's working in tandem with the best and the brightest in the IBD community, and you're making progress. You're part of the progress. You're moving the dial to improve care, not only for your child, but for all the children in the network and all the future children that may be diagnosed with inflammatory bowel disease. That kind of impact is seldom seen in anything else that you do. This is a real, incredible, tangible, fulfilling thing that you can be part of immediately. Next slide, please. So to join the parent working group, simply go to the ICN webpage and click on Patients and Families. Next slide, please. The parent working group is building a bridge for a better tomorrow. You can be part of improving that care, again, not only for your own child, but for others that will come this way. You will be a bridge builder. And again, we value your opinion. It's important, and it's absolutely essential if we're going to be able to improve care for children and improve families. Thank you very much.
Thank you so much. That was really wonderful. And you all have just done such fantastic work, and it's a blessing to get to work with you. I want to go right to the next session. There are a number of folks who are going to present here. I'm going to let them introduce themselves. This is, I think this is the section that we expect the most interaction and kind of our keynote for the night. So without further ado, take it away.
Hi, everyone. I'm Elise Morrow. I'm going to let my other group mates introduce themselves, but we're going to be talking a little bit more about advocacy amongst patients, families, and the community, and such a great topic to talk about right now since it's World IBD Day. So I'm excited to get started.
All right. Hi, I'm Seth Kahn. I'm going to talk about self-advocacy in the doctor's office, specifically around 3 areas: advocating around your symptoms, advocating around care and quality of life, and advocating around your own health literacy. So starting with self-advocacy in the doctor's office, I think the classic story about this, which I've heard a lot of variations about from friends with IBD, is the story of diagnosis. And for me, it was my primary care doctor, but often doctors can think it's just acid reflux or nerves or whatever. And I was just in 6th grade when I was diagnosed with Crohn's. So I didn't know much, but often something is wrong, even if your doctor isn't convinced. But this is just one example, even if it's happened in the past, obviously for all of you, since you're here, but it represents this broader idea of how important self-advocacy around symptoms in the doctor's office is. If you speak up for yourself and you talk about your symptoms, your doctor can get the full picture of what's going on and can treat you in the best way possible. Next slide, please. So next, I'm going to talk about advocating around care and quality of life. I used to take pre-meds before my Remicade. They added an extra 30 minutes of waiting to my infusion, and I was sleepy for the rest of the day. So I did some research and I talked to my doctor, and he looked at the data, and to my surprise, he agreed to discontinue the meds, and I haven't had a reaction since. So it's what I'm getting at is that it's super important to advocate for anything that can improve your quality of life or quality of care. Nothing is too small, because anything to make your IBD journey easier is worth it. And your doctor will really appreciate you bringing things to their attention and getting engaged in the process. Next slide, please. Finally, I'll talk about advocating around health literacy. Knowing about your health and understanding what the doctor is saying is super important. It's really important to ask your doctor questions about things you don't understand or things you need clarification on, because understanding your health is super important to your own care, and it's super important to taking care of yourself. My biggest piece of advice for this is to have a running list. Every time you think of something between visits you want to ask or clarify, write it down. Maybe it's in your notes app or a Word document or just regular old paper, but it's really good to write things down so you can remember them. In fact, at my appointment just a couple of weeks ago, I forgot to ask a question about whether I still needed observation time after my infusion, which I've been getting for 6 years. And I forgot to ask it because I didn't write it down. So it's really important to do that so you can remember. So just to recap, it's really important to advocate for your symptoms, explain them to your doctor. That way they can get the full picture and treat you. Number 2 is to speak up to improve your care. No matter how small it is or how small it seems, it's really important to talk about whatever you need to talk about. Number 3 is don't be afraid to ask when you don't know something. And then finally, number 4, which seems to be number 1 for some reason, is to keep notes between visits. That way you remember what you need to say and you can talk to your doctor about it. All right, thank you.
All right, so I'm going to be talking a little bit more about advocacy at school and work. So first, I'm in college now, but throughout high school, I was diagnosed right before high school, and I didn't really know anything about Crohn's at all. So I really relied on my doctor, my guidance counselor for my accommodations. And throughout freshman year of high school, I went through a lot of changes with starting Remicade for the first time and just navigating how to balance my stress with my disease. So a lot of the stuff I kind of learned on the way. But the biggest thing I would say about doing advocacy with school is that your accommodations are not set in stone. Things can be added to them, things can be taken away that you don't need, and that it's really important that you speak up for that. For example, when I went to college, one of the biggest things that I didn't have on my accommodations was priority registration for classes because my Remicade infusions were taking so long at the time. And I would be on Benadryl like Seth was, and I'd be totally fried for the rest of the day. And I couldn't take any classes after a certain period of time. So it was really important for me to add those on to my accommodations list. And then as I kept going throughout college, I learned that apparently college food is a trigger for me, which was interesting. But I also had another friend in my dorm that had IBD, and he was having the same issues as I was. So we both went to accommodations and we're like, something needs to change. Like, we're both really struggling. And the schools are very good about working with you with your accommodations. But when it comes to accommodations, you're the person that's captaining the ship. You have to self-advocate for yourself. Your parents shouldn't be, to some extent, if you're younger, yes, parents should be advocating for you for accommodations. But if you're in high school and college, you're the only one that really knows what you need in terms of accommodations. So don't be afraid to go up and ask for them. And then advocating in the classroom, it's really important for me to introduce myself to my professors because at the college level, you send out your accommodations letters via email, and I can be in a lecture with up to 50 people and they don't know who I am. So I like to go up to my professors and introduce myself and let them get a face to the name. So if they know that I'm struggling or that if I need to use my accommodations, that I will be in touch with them and that they know who I am and they're not mixing me up with other people. But it's also important that you stay on top of your accommodations because there are other kids that have accommodations and that they use them frequently. And sometimes people forget. So it's okay to just go up to your professor and be like, hey, listen, like I didn't finish my test on time. I need a little bit of extra time. Like, just make sure like you keep reminding them and stay on top of your accommodations. But overall, your guidance counselors, your advisors are there to advocate for you. So if you are having trouble in the classroom and you don't want to share your symptoms or like what's going on in your personal life with your teachers, your guidance counselors will advocate for you and they are there for you. So don't be afraid to use the people around you to help with advocating in the school setting. Next slide.
Hi everyone, I'm Lucy Miller, and I'm going to talk about community advocacy and getting involved with advocacy. So advocacy in the community helps raise awareness for Crohn's and colitis, supports other patients, and for me at least, I found it to be incredibly empowering. You can help with fundraising efforts that help pay for new research and community events such as Camp Oasis, help support other patients, or help educate the greater population about what life with IBD is like, which is definitely a huge thing today for World IBD Day. I've noticed all over Instagram, people posting little infographics to educate the greater community about it. But some options for community advocacy include getting involved with large-scale organizations such as ImproveCareNow. Also, the Crohn's and Colitis Foundation has the annual Take Steps walk. And you can also help support legislative advances in support of Crohn's and colitis awareness and accessibility. You can attend or volunteer through Camp Oasis or help work on legislature such as Ali's law, which is the law requiring retail establishments to make their employee restrooms available to people with certain medical conditions, which includes IBD but isn't limited to it. And it was passed due to work by an IBD patient who was only 14 at the time and was denied access to a bathroom during the middle of a Crohn's flare-up. And she ended up meeting up with her representative to draft a bill that's now passed in at least 15 states. I know through the Crohn's and Colitis Foundation, you can get restroom access cards that legally require establishments in these states to let you use their restroom. And getting involved in advocacy is also an amazing way to work with other IBD patients and get to know them and understand their experiences. I've met a lot of amazing people by volunteering with the Crohn's and Colitis Foundation and through ImproveCareNow. And many of them are close friends now, which is a really cool benefit of doing that kind of work. There's also a lot of ways to support other IBD patients in the community, such as through the PAC toolkits, which we already heard a lot about. And even if you don't feel like you have IBD totally figured out for yourself, you can still help other people and help yourself as well by getting to know their experiences and talking about it. Because no one expects you to know everything, but it doesn't mean you don't have anything to offer. Next slide, please. So with my experiences with community advocacy, I was super hesitant to get involved with it. I didn't even want to get involved with anything. I didn't go to Camp Oasis the first year I could have because I was too scared to. But once I ended up doing that, getting to know other IBD patients has completely changed my life. And the advocacy I do now centers around helping other patients find a community like the one I've been lucky enough to find. So I mostly found that at first through attending Camp Oasis. As a camper, I was a virtual counselor last summer. I'm hoping to be a virtual counselor again this summer and potentially in person once that's an option. It's definitely way more accessible virtual for new campers who might be afraid to stay overnight somewhere for a week. But it's definitely can be really intimidating to get involved with community advocacy or even with community groups. But in my experience, it's been so life-changing. And I've met so many inspiring people along the way. And it can be really powerful just to be able to share your story and know that it means something to other people and that it helps them find a community. Yeah. Next slide.
Hi everyone, I'm Fiona and I'm going to be talking a little bit about advocating for yourself and advocacy in social settings. So like, for example, when you're hanging out with your friends. So by advocating for yourself in these situations, you can potentially enjoy yourself more and have it be a less stressful event. So for example, going out to eat, I know can be stressful for a lot of IBD patients. So if you and your friends are planning to go out to eat, one of the ways you can advocate for yourself is suggesting places that you know you're comfortable eating or that you know have food that you can eat. And also in my experience, I have found it helpful if you're comfortable telling a couple of your friends about your dietary restrictions, because then they can help advocate for you and also watch out for you. This is especially helpful if you're like in a larger friend group setting, and you have like one or two friends who know what's going on, because then they can help your voice be heard. And then in a similar manner, you can advocate for yourself in social settings by suggesting activities that you have the energy for or that you're comfortable doing. So perhaps you could suggest an activity where you know the area and know where open bathrooms would be. And also as a patient, I think one of the most important lessons that I've learned is knowing that it's okay to have to cancel plans if you're just having a bad IBD day. And that's another way you can advocate for yourself. And I know some of our PAC members are in college and maybe their friends want to go out drinking, but they're not feeling up to it that day, or they know that that triggers their IBD. They can still hang out with their friends and be the designated driver and still have a good time. So that's some of the ways our PAC members have advocated for themselves in social settings.
Hi, folks. I have the unenviable position again to follow the pack. So this is Jill again, and I'm representing the parent perspective on advocacy. And really, from our perspective, advocacy is about changing what is into what should be. And I want you to think for a moment, have you ever been in that circumstance where you're sitting around thinking, you know what, somebody should do something about that? Well, guess what? That's you. It's your voice, it's your experience, and that's what's going to generate improvement and change. And I think I just wanted to point out how important that idea of perspective is. And I love this little cartoon to the right where it says, reality can be so complex that equally valid observations from differing perspectives can appear to be contradictory. Now, that's not to say that we're in conflict with what's happening, but I think it illustrates that we can be looking at the same situation and take something entirely different from it. And truly, if we're thinking about improving care, we need to look at the problem not just from one angle, but from multiple angles. And so I think that's the value of having other stakeholders, all the stakeholders, at the table. And that's a unique thing about ImproveCareNow, that you don't need to be a PhD. You don't need to be a researcher or a doctor. You need to be somebody who has an experience, somebody who has passion, somebody who's interested in making positive change for yourself and others. Next slide, please. So where does this come from? So advocacy from a parent perspective is about valuing and embracing the different paths to achieve our shared destination, which is improved care. And again, I love this cartoon, this little depiction, because you know what? We're coming from different paths. We have physicians and nurses and dietitians and mental health professionals and patients and caregivers. And we all have a different vantage point. We all have those different perspectives that we're bringing to the problem. And that's how we're going to improve care, guys. This is our opportunity to get to that destination. And regardless of where you're coming from, your journey has value and is critically important to having us move that pendulum. Next slide, please. So where do we begin? It begins with acknowledging the value of the lived experience to improve care. Nobody knows what this journey is like better than those who have lived it. And not just lived it for 15 minutes and not just lived it during a 20-minute appointment, but lived it 365 days out of the year. You live, eat, sleep, and live with this 24/7. That has value. That makes you a subject matter expert. It grows with local centers, partnering with parents and patients. And I've heard lots of situations where I've asked different centers, really passionate physicians, gosh, have you partnered with your patient? And I hear things like, we really love to, but we don't have the bandwidth. We don't have the person who's going to be able to work with our parents. We don't. We talk about barriers, but we don't talk about solutions. And I would suggest that if you think back, and I'll use myself as an example, before my husband and I decided to have children, there were all sorts of reasons why, we didn't have enough money, or the house wasn't big enough, or we wanted to be more secure in our careers, and all these different reasons why maybe we should put it off. But we got the greatest advice, which is there's never going to be the perfect time. You're never going to have all of those things in place, and everything is not going to line up in nice, neat little rows, and you do it anyway, and you figure it out. And as Kristen mentioned, improvement is not about perfection. It's about coming back, and about tenacity, and about really putting that passion to partner with our local centers. And it's going to be messy, and it's not going to be perfect, and it's going to be kind of awkward. But the idea is that persistence and that passion is what's going to start growing it. And eventually what's going to happen is it's going to take root. And it might take time, and you might need to replant, and you might need to redo it. But let me tell you, it's going to be worth it, because you're going to see the actual impact of your work locally and with your local families and your local patients. And then that experience can be leveraged nationally, and then more people benefit from it. Patient and parent advocacy is sustained when all stakeholders have a seat at the table. And again, not just at the national level, not just, in our little committees, but in all areas of ImproveCareNow, in all areas of our local centers. That's where we're going to make sustainable change. And it's leveraged when those lessons are shared throughout the network for the benefit of all. And I think that's one of the most interesting and impressive things about the ICN network, is the idea that we seamlessly share and we shamelessly steal. And the fact that somebody in San Francisco or Stanford or Atlanta or in the Midwest, somebody's doing something fantastic, I can take that and I can use it in Boston, so that our kids in Boston might benefit from it. And conversely, things that we might be doing in Boston might be shared down in Florida and Nebraska. That's the beauty of this network, that the reach is so far reaching, and the impact that you can have is staggering. And there's really few places in your life really that you can have this kind of impact. And so that's why advocacy is such an important part of this organization. And that's why I feel so passionately about it. This is real tangible change. And what kind of reward do you ever get, like in life, when you really feel passionate about something and see how that really improves the lives of others? So that's my takeaway. That's the parent perspective. I think we're stronger together. Thank you.
All right, so now we're gonna just break out into 5 breakout rooms, and we're gonna have everyone divided up so that we're gonna talk about different ways we can advocate in the settings that we talked about. Okay, so what we're gonna do now is we're just gonna come back into the main room and kind of discuss what everyone was talking about in their breakout rooms. So why don't we start with Seth's group?
Yeah, so I think the first thing we were talking about was kind of this dichotomy that makes it difficult to talk to your doctors and bring things up, which is that your doctor obviously knows a lot more about medicine than you do, but you know a lot more about yourself and your own body than your doctor does. So bringing those together is sometimes difficult, but just being able to talk to your doctor. And we also talked about like how some doctors, there were a lot of different experiences between some doctors who were not really understanding, and other doctors who worked really hard to figure out what was going on, and that it's okay if you need to find a new doctor if it's not working for you. So yeah, that's what we talked about.
All right, awesome. So I was the school group, and we had a lot of questions in our group, so I kind of was just answering questions, but we talked a lot about my experience with college and some stuff that you would look for when you were, if you're touring colleges. So I told everyone when I was touring for schools, I emailed accommodations offices beforehand because I needed to know, like, for a personal standpoint, like how good were accommodations? Do people generally like follow them well? Stuff like that. Like I remember a teacher in high school told me, she's like, oh, you should look at Hofstra. Like they have really great accommodation program and they're really good. So I looked at Hofstra because I also had a program that I was looking into. And then I actually had a question for the PAC actually. So someone asked about if there is a list of colleges or people who have been to college that had good experiences with accommodations or stuff like that. So I don't know if we have a specific list of colleges, but I know we have a toolkit for schools and like what to ask and ways to like navigate advocating in a school setting. But I don't know if we have a specific list or if that can be created, but I can't cover all schools.
I know, I'm looking it up right now. I know that on the Crohn's and Colitis Foundation somewhere, there's like a map of different colleges around the world. I think it's on like their campus connection page. I'm not sure exactly where, but I know that people who are in college currently with Crohn's and colitis can put their contact info on it and like where, like what school they go to. And so when I was choosing between schools as a senior, I went on that map and just like looked to see if there were people from that school on the map with Crohn's and colitis. And I ended up finding somebody who goes to the school I go to now, which is Bryn Mawr College. She's a year above me. We're still friends, but I just emailed her and I was like, hey, like, what are the accommodations like? Is Bryn Mawr okay with Crohn's disease? And she ended up being my overnight host when I actually visited the school. So it's not really a list, but it is a way to potentially like talk to somebody at that school who has experience with the accommodations office. I'm looking it up right now and I'll see if I can find a link for the chat.
Yeah, also Lucy had this in her slides, but I'm a peer mentor for Peer Strong, which is a CCFA app, and it's like the IBD buddy system. So like if you have questions about like college specifically, there are people there that you would match with and they would talk to you about it. So I have a bunch of people that I'm matched with that are going through the college process and have questions or need emotional support while they're in school. So I do a lot of stuff with them with regards to school, but I don't know how much they're doing with Campus Connection. I feel like they transitioned to Peer Strong when COVID hit just because we were having trouble getting support groups together virtually. So this was kind of the solution. But I would honestly, like, I went to school and I met like 3 people within the first week that had IBD, and like we kind of had our little like support group together. So like if I'm ever having a hard time, like I go to my friend and I'm like, listen, like I need help, and like we kind of just like empathize with each other just because we're going through the same thing. She's in a similar major as me, so she understands the stress that I go through. And like I just have another kid that like I'm friends with, and I'm not really great friends with him, but I see him in the library and he comes up to me and he goes, how you doing? You're good? You good? Like, it's just kind of like you'll meet people when you're there. Like I was very open about my Crohn's disease and I've met so many people, and now I kind of have a network that supports me at school. And like, we kind of will come together if we're struggling, and sometimes we'll go to accommodations together to be like, listen, like we're all struggling. We need help. Accommodations, like, can you do something about this? And like, they'll usually do something about it.
Can jump in with our parent breakout group. So we talked briefly about folks who are engaged at the local level and just the struggles we've had due to COVID and just being kind of meeting in those routines. Also, you know, sort of the added challenge of hospitals not really knowing what to do with parent advocates, that sometimes you want to be, you know, engaged in that, but it's a relatively new concept when it comes to healthcare to have, you know, parents and patients so intimately involved in the quality improvement process. And so we discussed that briefly. We also had a parent bring up the challenges of advocating for their child once they turn to 18 years old. And so we know that at 18, you don't magically become an adult, and, that people develop at different times, and how it's a struggle sometimes to transition from that, being a parent advocate for your child and then passing that torch to your child to let them become their own advocate. And then it's a process. It's not always linear. And so sometimes that can be challenging. So we discussed that a little bit. And for those folks who were in that group who are interested, the next parent working group call is going to be specifically around transition and some of those barriers with transition. So I would strongly encourage you to join that call. And I welcome the PAC to join as well, because we're going to be meeting with some folks from ICN who are trying to understand what those barriers look like so that they can develop some processes to help, smooth out that challenge. This is a perfect example of how that lived experience can result in improved care, that this is clearly a challenge for many folks. It's not, if you're experiencing it, likely there's many others who are. And so that lived experience, again, is going to be so fundamental to really changing the way we do things and preparing both parents and patients for that transition. So I thought it was a great conversation. Unfortunately, it was cut a little short because we were short on time, but certainly appreciated the opportunity for the conversation.
And Fiona, do you want to talk about your group?
Yeah, sure. We talked a little bit about advocacy in general and the different ways that advocacy at different levels, from like the individual level to like smaller community groups to a large community on a national scale, can influence advocacy, and that there's just in general a lot of ways to get involved if you're interested.
All right, I think that's all we have planned. Christian, if you want to take over.
Sure. There we go. Everybody should be able to see now. Thank you. Oh no. So first I want to say thank you everybody for staying on for an extra few minutes. It sounds like everybody very much enjoyed the breakouts. I do want to say, like, that's something that we can do more of in the future. Everybody who attended this tonight is going to get a survey. And we're going to ask for your opinion on how things went, what we can do better, what we can improve and learn from. Believe it or not, these events used to be 4.5 hours. They're an hour and a half now, or an hour and 39 minutes, because folks suggested they were shorter. We put the breakouts in because after the fall community conference, folks talked about wanting more participation and for it to be more interactive. And so I want to encourage you to fill out that survey when you get it. It should come to your email, and make sure to let us know how it went and what we could do better. I do want to plug again, IBD Success Stories. The Stanford Center is doing this. It's going to start in 20 minutes. And you can scan that QR code right now, or I can put in the chat where you can click an RSVP if you're interested. And what we ask you all to do going away from here is go to our site, try to find something that you didn't know about before, and share it with somebody. We believe that working together, we can achieve more, and that means, lots of folks who are here today wouldn't have been on this call if it wasn't for somebody sharing with them or reaching out to them. And so that's our ask coming out of this. I already mentioned the survey. I believe the link is also in the chat now. Sydney, is that right? I think it is.
Yes, the link is in the chat. You'll also get it in the coming days, just in case you don't want to fill it out right now.
And so I think, finally, I just want to say thank you both to everybody who attended and to all the presenters. It's a busy time for a lot of folks. School is ending. Folks are moving, and they've taken time to be dedicated enough to this to develop these presentations and share them with everybody. And so a big thank you and round of applause. I think that's all we got for tonight. Thanks, everybody. I had a really good time. Follow-up emails will be coming. Glad we were able to see all of you tonight, and look forward to getting to meet and get to know you better in the future. Thanks so much.